Good morning from UN City in Copenhagen, Denmark. My name is Alison Ekberg, and it is my pleasure to welcome you to the launch event for our paper, Quick Buys for Non-Communicable Diseases, published today in The Lancet Regional Health Europe. I am delighted to be joined in the studio today by Dr. Hans Kluge, Regional Director for WHO Europe, and two of the paper's lead authors, Dr. Godin Galea, Strategic Advisor to the Regional Director on Non-Communicable Diseases and Innovation, and by Professor David Stuckler from University of Bocconi. Before we dive into the discussion today, I would like to hand the floor to Dr. Kluge for opening remarks.
Thank you. Dear colleagues and friends, good morning, good afternoon. What can we do to address the growing burden of non-communicable diseases? We are here today to address that question. In 26 weeks, world leaders will gather at the 4th UN high-level meeting on NCDs to take stock of progress toward the Sustainable Development Goal target of reducing premature mortality from NCDs by a third by 2030. As a region, we have failed to meet our commitments, and if we do not act now, we stand very little chance of achieving them. But there is reason for hope. Shining examples of success across the whole pan-European region. Denmark and Estonia are among 10 countries to achieve the European Programme of Work target for reducing premature mortality from NCDs by 25% by 2050. France and Spain have halted the rise in obesity. The Netherlands are on track to achieve the global target of reducing tobacco use by 30%. Kyrgyzstan and Lithuania are showing declines in alcohol consumption. And Kazakhstan has reduced mortality from cardiovascular diseases and improved acute care for stroke and myocardial infarctions. And I could go on. This progress is linked to the implementation of the NCD best buys, cost-effective and evidence-based. We have the tools, the knowledge and the ability to succeed. Yet 15 years since their introduction, implementation remains uneven and frankly disappointing. So where do we go from here? Today, we introduce the Quick Buys, actions that deliver measurable public health benefits within 5 years or less. A very innovative approach to accelerating the implementation of cost-effective interventions. This is about impact and timing. We live in times of incredible technological advancement and significant challenges. But while we are living longer, we are not necessarily living healthier. As we enter the last 5 years of the SDG era, we must speed up implementation of the solutions that can reduce the gap between years lived in good health and years lived without. This is why addressing NCDs is a core pillar of the second European Programme of Work 2.0. Amid a pharma crisis marked by rising megatrends like climate change and disinformation, I reiterate WHO's commitment to disseminating science and evidence to inform action that drives us toward a more healthy and more resilient region. That is what we are doing today, issuing a call to action for governments, civil society and individuals to unite and commit to action that saves lives today and tomorrow. With that, it's my great honor and pleasure to officially launch the Quick Buys. Thank you.
Thank you, Dr. Kluge, for that call to action. You remind us both of the urgency and the opportunity before us. And so I just want to say, we have the tools and we have the evidence, and now it's time to accelerate action. So the Quick Buys we're launching today speak directly to this. So I think I'd like to come to you, Godin, and I want to ask, why the Quick Buys? What is the motivation behind this, and where do these come from?
It's a very proud moment today, and also one that fulfills an ambition of a couple of decades. As I was a younger regional advisor in non-communicable diseases in the Western Pacific Regional Office in Manila, I noticed that there was an accumulation of evidence. I saw the graph, for example, of the decline in stroke mortality in Japan between 1965 and 1985, a plummeting line that took Japan into being the country with the longest life expectancy in the world. And the annual reductions were so fast, it was amazing. But it wasn't just Japan, it wasn't just stroke. If you looked at the United Kingdom, for example, even at that time, I could see that when they switched from opportunistic screening for cervical cancer to systematic screening with call and recall, the coverage rates for the screening rose immensely within a year or two, and mortality started to fall within the same period. And yet I was constantly battling with people who thought of chronic disease, with the word chronic built into it, as if you could only get benefits or changes over a 20-year period. And for me, the idea of collecting a few vignettes of this nature was interesting, because it gave me an example of a set of examples for a presentation that I actually called the acuteness of chronic disease. Because chronic disease trends, even if an individual illness in one person may develop over a long period, but there are policies and interventions that have been shown repeatedly over time that they can have an immediate impact within 1 year, within 5 years. So I thought, over time, WHO developed then the second building block, that is the best buys, looking at not only the interventions that were effective, but that could be cost effective. And this was launched within the UN high-level meeting process, and received a lot of political support, but not enough, as Hans has just said, didn't receive enough implementation. So, is there some way that we could bring these two ideas, the rapidity of population benefit with the existing of cost-effective interventions, into one concept, which we termed, for better or worse, the quick buys? These are interventions, 25 of which that can give you measurable population benefit within one electoral cycle. So the next time, if you are a policymaker and your minister asks you, what can I do before the next election? Now you have a list that you can present.
Yeah. So why do you think they're critical right now?
They're critical because we're at the UN high-level meeting process. Countries are going to start negotiating the political declaration. There will be a lot of back and forth negotiation. At least if people are in that drafting room, there is another tool for NCD advocates within countries to be putting forward a set of lists, a set of interventions. They are not, of course, all the interventions. They're not comprehensive, and we'll get into the methodology and how that limited the range of what we could see. But we have enough of an example that countries can use to have a very strong political declaration coming out of our 4th high-level summit in 26 weeks' time.
Well, thank you for that background, and that you brought up the methodology, because now I'd like to go to you, David, and if you could tell us a bit about the methodology behind defining and identifying the quick buys.
Excellent. I still remember the conversation, Gowden, 2 years ago when you came to me with the idea, with the challenge of, can we identify the public health policies for chronic diseases that would have the fastest effects to guide action? And it was such a simple idea, but such a bold and transformative idea. I thought at first, surely this has already been done. And then when I realized it hadn't, I thought, well, maybe it's because it can't be done. And then suddenly it dawned on me just what a difficult task this would be.
Indeed.
To do this the right way, the ideal way, would take decades. We'd ideally look at all the different chronic disease policies and map out, do interventions, and figure out the timing of their effects. but we don't have that kind of time. We can't wait that long. So we started with the 49 so-called best buys and recommended interventions, which are already powerful, established policies that work, and we just bolted on a method and approach to figure out how fast they could be. So what we did is we went and revisited all of these, dug through archives and troves of evidence to find the earliest possible detectable effect. But we couldn't just find any effect. We had to curate this evidence. We had to make sure this was robust and strong enough that we could really stand on it confidently. So we took a search hierarchy approach, the kind of approach that's used by systematic reviews, that's validated to produce some of the best evidence to drive medical guidelines. And in that hierarchy, we looked at studies that had already curated and validated the evidence. We sifted through that to find the earliest possible detectable effect, and those that we could identify within 5 years became our set of the quick buys, and we found 25 of them. A few caveats. Just because at this point we didn't find evidence doesn't mean that that evidence doesn't exist or we won't find it in the future. This is likely to be an evolving list as our evidence updates over time. And the other thing to note that when we looked for quick buys, we calibrated and linked them to UN high-level targets. So these are targets that countries, member states of WHO have already signed up to, have already agreed to achieve. So this is an end of a beginning for us, but it's a powerful advance in how we can help guide policymakers to achieve quick results, and it leaves no excuses for inaction.
Thank you very much, David, for that explanation. And I can confirm that this was no small task, and I think it's opening Pandora's box. As we begin, we found more and more things that needed to be investigated. So thank you for that. But that brings me to another question. Godin, are quick buys quick wins?
Definitely not. In a way, we are now invested in the term, but we were midway, we started to doubt ourselves, to say, because too many people were confusing a quick buy with a quick win. These are not quick wins. No. I'll just take one example. Smoke-free public places achieve population benefit within less than a year. So many countries still have to implement and enforce smoke-free public places. So there is nothing quick about the win, but once you implement, once you enforce these policies, then you get your real benefit. So please, for anyone who's citing or referring to the paper, don't trivialize it by calling it quick wins. They are hard-fought but quick buys.
Thank you for that distinction. Well, let's get to it. Following, as we heard from the best buys, the quick buys targeted the leading NCD risk factors: tobacco use, alcohol use, physical inactivity and diet, as well as key disease groups: cardiovascular diseases, diabetes, chronic respiratory diseases, and cancer. So Godin, why don't we start with tobacco? What can you tell us about the quick buys for reducing tobacco use?
Now, as we go through these lists quickly, you will start to find, at least our viewers will start to find that it's, in a way, there's nothing new, because our viewers who have registered and come online know about the quick buys. So please do not stand back and be underwhelmed by the actual interventions. You know these interventions and you have been advocating for them. Just think, though, that now you can, there's our literature review and our methodology will allow you with more authority to claim that 100% smoke-free public places and workspaces, increasing excise taxes and prices on tobacco, pharmacological interventions on, for tobacco cessation will give you population benefit within less than a year. Graphic health warnings and advertising and promotion bans delivered benefits in slightly longer, but we have enough price, availability and marketing are really great entry points for tobacco with fast results.
Thank you. And can you actually, let's go next to alcohol. How can we reduce alcohol use?
Alcohol is very similar to tobacco. We like to say that price, availability, and marketing of alcohol are among the most highly prized best buys. Each of these results in population benefit in less than a year. And sneak preview, we're actually working on a natural experiment with David, looking at Lithuania's, a natural experiment study with Lithuania, with David on Lithuania, showing how alcohol policies have had a population benefit, and the results are quite dramatic and quite fast over a short period of time. It's also promising, and we will hear about this more and more in the coming months as our team continues to work on screening and brief interventions in the area of alcohol, screening and brief intervention for hazardous use of alcohol at the clinical level can have an impact on the individual even less than a year, or at least around a year.
That's excellent. Well, let's go. There's two more risk factors we want to address, and that would be physical inactivity and diet. Why don't we go to those? Let's start with, let's see, diet.
Even as obesity starts to stall, maybe not yet halt in tobacco, but in France and Spain, we are seeing this really wonderful result that they seem to have stalled the obesity epidemic, and we'd like to see a few more years of results to be able to confirm that. But we've been dying to see some hope, some glimmer of hope in the area of reducing preventable obesity, at least. In terms of improving the quality of the diet, we've been promoting some best buys like front of pack labeling, food product reformulation, each of which gives some change in behavior within a year or less. And there's another best buy of behavior change communication, and for physical activity, the brief interventions like we have for alcohol at the clinical level, the so-called green prescription, they are all benefits, resulting in benefits within less than 1 year.
Wonderful. Thank you. So actually, let's move on to some of the disease groups we talked about. So starting with cardiovascular diseases, what are some of the quick buys to address cardiovascular disease?
Yes, it is well known in the area of cardiovascular diseases. There's a well-known saying that brain is time, or heart, or time is brain, time is heart. The quicker you respond to with effective interventions to an acute cardiovascular event, the higher the likelihood of survival, the higher the likelihood of a return to full function and the success of rehabilitation. We have a number of interventions that best buys that we have identified that can achieve this within less than a year. And of course, going back to our discussion on quick wins, once someone survives, they need aftercare, they need rehabilitation. So this is another example, not about a quick win just because of what you need to do before, but you also need to follow through on these quick buys. That helping a person survive their first month after a heart attack or a stroke with a strong acute intervention still requires the rehabilitation, the follow through in order for that survival to persist.
Thank you. So what we talk about diabetes, and I know we have the global targets on diabetes now, and what do we have under the quick buys for diabetes?
So with diabetes, we have both targets that are related to diabetes itself. For example, the control of glycemia, which it stands to reason. If there's an imbalance in glucose levels and you give the right treatments, then you can bring it to a better under control. And so glycemic control can be achieved within a short while. This is well known. But we've also identified that there are interventions that can reduce the risk of cardiovascular disease even within that period. Statin use in people with diabetes who are aged over 40 years. The control of blood pressure alongside with the control of blood sugar, again, has impacts that are measurable within or up to 1 year. So we have a number of interventions that can improve the quality of life now, as well as the risk of future events or other complications later in life.
Thank you. So that brings us to chronic respiratory disease. What's the news there?
So chronic obstructive pulmonary disease, which is one of the interventions, one of the diseases under the heading of chronic respiratory disease, we found that one intervention, the acute treatment of exacerbations with inhaled bronchodilators and oral steroids, will have an impact in less than a year. And it's understandable that there are less rapidly acting interventions here because many of these respiratory diseases are actually evolving in the lung over a period of time and lead to irreversible changes. So with COPD, it's not like we are trying to reverse the changes, but to keep a person living the best life that they can. But again, we can do this with treatments that have almost immediate effect.
Great. And then last but not least, let's talk about cancer.
Within cancer, we have one cancer, cervical cancer, that is slated for elimination. It's the only cancer at this point where we know entirely its causation. So it's, we have already adopted the cervical cancer elimination initiative globally that involves vaccination, screening, and treatment. And we were able to show through these reviews that human papillomavirus vaccination, HPV vaccination, screening for cervical cancer, and early diagnosis programs for breast and cervical cancer. Indeed, these were already the interventions that were part of the original inspiration for this study so many years ago. These have an impact within less than a year or up to 1 year.
Thank you. It's truly impressive to see how many of these can actually have an impact in less than a year. And I just want to ask another question. I think it's important to recognize, we talked about the best buys, but these interventions, they're not just the best buys. We looked at the best buys, we looked at what were called the good buys and other recommended interventions. Maybe, David, coming back to the methodology, could you say a word about why that was expanded?
Oh, that's a really good question. So we wanted to take a broad set of cost-effective policies. So these are policies that range from costing as little as $100 per disability-adjusted life year saved through to $20,000 for the same metric. So we really wanted to cast a broad net and identify what was fast from those. That's why we did start with a larger set of 49.
That's excellent. And I think also important to know, this isn't like we're not reducing, we're adding something here. I think what's new is we're adding the dimension of time. And I think it's important to think of it that way, not that the other interventions remain as important as ever. However, for those looking to see, something new, we can now say how much time it will take. And I think that's really what's different here.
And indeed, it's very important. The best, the best buys remain the canon. Yes. This is not a replacement for the best buys, but for a selection, a subset of them. This is adding that extra layer of strength in advocacy.
And that's, I think, an important point to make. So now, Dr. Kluge, I'd love to come back to you, and I'd like to bring you back in and hear from your perspective, how you think the quick buys can contribute to the transformation that's needed in the WHO European region, and also how their significance in the context of the second European program of work and the current challenges we face.
Thank you, Alison. Let me congratulate Gordon, David, the whole team for this really groundbreaking work. I think what we're discussing in the quick buys is really exemplary of the spirit of the EPW 2.0. Remember, I always advocated since the very beginning for 80% of continuity, 20% of innovation. Yes. So we have the best buys, we have the quick buys. As you were telling David, I like very much you say, it's simple, but at the same time it's bold and transformative. And I think that's what we need to rethink, reimagine. Actually, straight after the launch, I will head for Warsaw to the meeting of the EPSCO, the 27 Ministers of Health of the European Union, where I will put this forth as well. You know, for the new health commissioner, cardiovascular disease is very high on the agenda. Already there is Europe Beating Cancer Plan. Now looking toward the cardiovascular disease, it fits straight into that new priorities of the multi-annual financial framework. Then I will go in April to the Minister of Health meeting of OTS, Organization of Turkic States, and ultimately end of the year in Tajikistan, who is currently the chair of the CIS network of Ministers of Health. So we are disseminating the continuity, but the innovation to accelerate, but always based on technical excellence, evidence which will remain the North Star of the EPW 2.0.
Absolutely. Thank you for that. Well, I really want to thank all three of you. I mean, no one's leaving yet, but I want to thank you, Hans, Godin, and David. And in a minute, we are going to turn to a panel of speakers for their reactions to the paper and how these findings might accelerate progress on addressing non-communicable diseases. But first, this video. Welcome back to the studio. I would like to welcome another co-author who was unable to join us in person but is with us online, Professor Martin McKee. Professor, thank you for joining us today. Please tell us, what is your reaction to the findings and what do you think is the significance of this work for the broader WHO European region? Over to you.
So the first thing I would say is that it's a reminder that often the relationship between risk factors and interventions is asymmetric. And that means that it can take a long time, many years of exposure, for example, people who take up smoking before they get lung cancer, many years of drinking before they get cirrhosis. But whenever you stop that exposure, you can get a very rapid impact. And it is a reminder that we often think, well, nothing can be done or it will take far too long. So I think it's important sending out that message. Even if it has taken a long time to get where we are, it may take a relatively short time to recover from it. It doesn't mean that the damage is all solved, but at least you can get health benefits. At least you can reduce deaths. Looking across the region, we know that health ministers have a real struggle. Often, and I'm sorry to have to say it, they're often among the weakest ministries in the government. Often the senior partners and coalitions get foreign affairs and finance and so on. So we need to give ministries of health every help that we can. And this paper does that by saying, here are the things that where you can achieve a demonstrable benefit in a relatively short period of time, an electoral cycle. Now, of course, you've got to start at the beginning of the electoral cycle. You can't wait until you're a year to the end of it. But at least it allows them to do things where they will have some measurable impact. And then hopefully persuade, the challenge we have in governments is that we have to convince leaders of heads of state, heads of government, finance ministries and others that the money that is spent in health will have an impact. Of course, many of these interventions don't even involve spending money. Things like reducing the increasing price and reducing availability and marketing may not cost anything, but we just need to give the information to ministries to help them make decisions that really will have a payback.
Thank you for those excellent points. I don't know if there's any comment from the studio before we go to our next guest, but I think they're very well made. And I think, again, the theme of time, how important time is here. So thank you so much, and I know you'll be joining us later in the session. So thank you very much, Professor.
Thank you.
Next, it's my pleasure to welcome Dr. Svetlana Nicolaescu, State Secretary from the Ministry of Health of Moldova. And this is a great segue. State Secretary, the Republic of Moldova has made important strides in reducing salt intake, in improving cancer detection, and strengthening treatment of hypertension. So, however, progress on reducing tobacco use has stalled. From your perspective, how might the quick buys help to build momentum and support your efforts to accelerate progress on tobacco by 2030? Over to you.
Good morning, and thank you for the kind introduction. It's a great pleasure to join this important discussion and to greet colleagues and partners from the WHO European region and beyond. I would start with mentioning that the Ministry of Health of the Republic of Moldova welcomes the launch of the quick buys and the compelling evidence they offer to support accelerated actions on non-communicable diseases. The focus on interventions that can deliver measurable results within a relatively short time frame, and we have seen from immediate to within 2 up to 5 years. So it is particularly valuable for sustaining political momentum and aligning with electoral cycles. In the area of tobacco control, where progress has recently slowed at the national level, the quick buys offer a strategic opportunity to reinvigorate our national agenda. The Republic of Moldova is currently promoting the revision of the National Tobacco Control Law. It is aligned with our commitments under the WHO Framework Convention on Tobacco Control, but also our broader EU accession agenda. However, this process has encountered delays due to ongoing interference by the tobacco industry, which seeks to weaken and postpone effective regulatory measures. Particularly in this context, the quick buys can serve as a powerful tool to strengthen our policy arguments and build broad-based support. And in the context of our today's discussion, particularly the already mentioned quick buys versus quick wins, I would like to highlight 2 points. First, to ensure that these quick buys truly influence policy, it is essential to properly introduce and communicate their findings to decision makers across the sectors. In this perspective, mobilizing broad-based coalitions will be key to amplifying the evidence and countering industry narratives. Engaging all actors, including civil society, academia, especially mass media, help to create the social but also political space needed to advance strong and health-promoting policies. The second, equally important, is generating national and local evidence that demonstrates popular support for tobacco control measures, including the quick buys. Politicians are more likely to champion bold interventions when they see that these are backed not only by science, but also by the public and by their own constituencies. Investing in public opinion research and showcasing the alignment between health policies and citizens' expectation can provide a powerful argument for action. In this way, the quick buys can serve as both a technical guide and a strategic advocacy tool to support Moldova's effort to meet SDG targets, strengthen implementation of the WHO Framework Convention on Tobacco Control, and ultimately protect current and future generations from the harms of tobacco. Thank you.
Thank you so much. You raised several great points. I think the issue of stakeholder engagement is critical. Also, the challenge of industry interference. As you know, that's some work a lot of work is being done on that as well here. And also the issue of monitoring. Monitoring is essential to show that, to demonstrate the impact. Again, I want to congratulate you on the progress you've made and really wish you the best with progress on tobacco. I just want to see if there's any reflections from the studio.
Just a salutation to State Secretary, whom we know each other from long periods of battling on these issues. So clearly, it's not. We know very well it's not a quick win, but one that would resolve a battle that we can win still.
Thank you so much for joining us today. We really appreciate it. Next, I would like to invite Dr. Aurelius Verruga, a member of the European Parliament, to join us. Dr. Verruga, thank you. So, Lithuania stands out as the only country to have implemented 3 of the quick buys for reducing alcohol use. That is, raising taxes, limiting hours of sale, and introducing a near total ban on advertising. As a result, alcohol consumption has dropped by 17%, putting the country on track to achieve the global target of a 20% reduction. So having served both as a Minister of Health of Lithuania and now as a member of the European Parliament, what advice would you offer to policymakers on implementing and enforcing these types of policies? And how does the focus on achieving measurable impact within a set time frame, as emphasized here, add value to that process? Over to you.
Thank you. Thank you for this introduction, and thank you for inviting me to this event, to this conversation, to share my thoughts. And I would like to start from saying thank you to Dr. Hans Kluge and Gauden Galea for their personal and organizational support during those times when Lithuania were implementing those measures you have just listed. And that was not an easy, and the international support at that time was very, very important. And starting maybe from your last part of the question about the quick buys, I would like to say that I think it's a very bold switch from best buys to quick buys. And I'll tell you from the political perspective why. Usually public health measures are taking a long time to demonstrate the effects. So for the politicians who are staying in the government, like for 4 years usually, they would like to see the benefits, and they would like to get, let's say, the political points to be demonstrated. If they start early at the beginning of the term, so they can demonstrate the effects at the end. We were lucky to do that in Lithuania, and we were able to demonstrate those effects at the end of the term. So that did not affect it so much, the political environment, because politicians are afraid that they will be attacked very heavily by the industry, which exactly what happens if you target the alcohol consumption or tobacco consumption. And talking about advices for the policy makers, first advice would be, and if I remember correctly, somebody of you already mentioned at least part of this, to have a plan from the very beginning of the political process. It's not the right time to ask government to do something when they already started their job, when they already have the government program, they have the action plan on this program. So what we have to do, we have to start very early and ask political parties to include those different kind of measures into the political programs, and ask them to make promises openly to the society. During the debates, there is a way, to ask those who moderate the debates to ask about, their opinion. So ask politicians to make open promises to the society. That would motivate them to move forward, where they would become politicians and will come to the positions. So the integration into political programs, it's the first important thing. Another important thing is to generate community support. In Lithuania, when we started to do the changes, before that, we had collected 60,000 of the real signatures, those who are recognized by the state institutions, like in referendum. So 60,000 of the Lithuanians supported those evidence-based alcohol control policy measures. So it makes, it creates credibility for them when you push them being as a minister of health. So you have then the political support of the society. And it has to happen before you start, not after. Because after, the other actors will start to play their games, and that would become a very, very complicated. Then definitely you have to have evidence and numbers to support you. And that's what the researchers do. And thanks for those contributed to this event and to those messages that are very important to communicate to political society. So those are the most important things that came into my mind, talking about what could be the advisors from the person who, let's say, have tried himself to do the things. So those are important things. And one more maybe to mention, where possible, because not in every case it will be possible, create balancing mechanisms. I'll give you an example. When we were deciding to ban alcohol advertisement, at the same time, we decided to have a foundation for the media, for them to have at least a partial compensation for their losses, because this is a huge money loss for the media usually. And with this money, we were supporting the social advertisement, the promotion of healthy nutrition, and the communication of other important health, let's say, messages around the society. So that helped to decrease, the protests from the general media. And the most important, I would say, you have to believe in what you are going to do. Because if you don't believe yourself what needs to be done, you will definitely not make others to believe in the things. So if you are a believer, then finally, sooner or later, the Prime Minister, Minister of Finances will become your friends and will step on your side. And don't be afraid while doing those things, because you are doing good things for people. So that would be my advices, and very good luck to all of you.
Thank you so much. You gave some really great points there. I think it's important to have a plan, to start early. I heard that it's important to engage the community. We heard this again. Thank you for those concrete examples about the need for balance and what you did to help contribute to your success. And I think, again, that we need the data and lead with conviction. Over to you, Hans. I see you.
Thank you. Yes, I really have to...
One second. We'll come right back to you in a second.
Yes.
I'm going to come to David or Godin. Would you like to comment on what we've heard now?
Just to again salute Aurelius, first as academic, then as minister, now as member of the European Parliament. He has been on the front lines and has demonstrated the very words that he is speaking here. Ours is a literature review. His is a daily struggle that he has gone through, and we all respect.
Thank you. Now back to you, Dr. Kluge.
Yes, I wanted to add my appreciation to my colleague and respected former minister and now member of parliament, Dr. Veriga. Thank you very much. I remember when this started, when it's afterwards, let's say that it's easy, right, to tell this was all planned, but there are so many unforeseen factors if you want to transform, and you had the courage to do so. So I really want to commend this, but also the State Secretary of Moldova and the Minister, Dr. Alan Nemerenko, who also is another example of a transformer. And I think we need these examples because political cycles become shorter and shorter, and it's more tougher to do large-scale transformation, but actually gives a lot of hope, really. And finally, also my appreciation to Professor Martin McKee, who is always watching that as a critical friend, that the evidence is also right there where needed. And all of this makes me to reflect a lot as WHO is going through a huge transformation now as well, that the vision is important, the team is important, quick wins is important, but never lose out of sight also the longer term benefits. So congratulations to everyone here. It's very inspiring, very inspiring.
Thank you. Thank you for that. Thank you again, Dr. Aruga. And now it is my pleasure to welcome Dr. Leila Stouroua, head of the NCD department at the National Center for Disease Control in Georgia. Thank you for joining us today. Dr. Stouroua, Georgia has made notable strides in reducing tobacco use and exposure through the implementation and enforcement of recommended policies. And as you now focus on advancing progress in other NCD areas, how do you see the findings from this study supporting those efforts? Over to you. Hold 1 second. Let's see if we can fix the sound. We're not hearing you. 1 second. Hang on 1 second and we'll get that fixed. Sorry about that. We're just going to try to fix this.
No.
Oh, now we hear you. Perfect.
You hear me
Wonderful.
now?
Yes, we do. We do. Thank you.
So thank you again for inviting me and my dearest respected colleagues. First of all, I'd like to extend my heartfelt congratulations to all the authors. You've really accomplished something truly remarkable, and you should be immensely proud of the hard work and dedication you invested to reach this significant goal to have quick buys. It's a testament to the importance of our collective efforts in addressing the growing challenge of non-communicable diseases, as NCDs also prevention is a way to achieve sustainable development goals. Regarding the insights presented in the paper, I would like to affirm that Georgia's experiences in implementing tobacco control policies resonate strongly with the findings discussed. We initiated comprehensive tobacco control legislation, introducing smoke-free spaces, large graphic health warnings, comprehensive bans on advertising, and these outcomes were both immediate and significant. We witnessed a reduction in smoking prevalence, decrease in the number of cigarettes consumed, decline in the incidence of myocardial infarction, stroke, and these outcomes clearly demonstrate that focused interventions deliver real results. Reflecting on the paper, I was a bit surprised to see that some interventions were not evidenced effective enough to be included in quick buys, such as taxation on sugar-sweetened beverages, quick lines, mobile cessation services, as well as breast cancer screening with mammography. And looking ahead, we are eager to leverage the insights gained from this paper to address unhealthy diet, especially excessive salt and sugar consumption, obesity, to strengthen our advocacy for reformulation policies aimed at promoting healthier food, healthier beverage options, and additionally, comprehensive nutrition labeling and effective behavior change communication, along with mass media campaigns, will play, I think, a crucial role in guiding our communities toward healthier lifestyles. And we really recognize that Gordon stressed sometimes now that quick buys may not always mean quick wins. And we must also acknowledge the complexity of implementing these interventions, and each strategy is unique, and it must be tailored to our local context as well. And success will require collaborative efforts that engage multiple sectors, including civil society, academia, private sector, and beyond. And as we move forward, I hope we can tap into additional support and resources from WHO Euros that will enable us to translate this robust evidence into effective policy actions. And in closing, let us remember that fight against NCDs, it's not just a public health issue, it's a moral imperative, and together, by prioritizing effective interventions and fostering cross-sector collaboration with politicians, we certainly can pave the way for healthier futures for all. Thank you.
Thank you so much, Leila. It's so good to see you. And it's been great to see how Georgia's success in tobacco control illustrates the quick buy approach and demonstrating impact even in the short term. But before we continue, I want to give the floor to you, Godin, to respond.
In a way, Leila's surprise at some interventions not being included in the list refers back to what David said earlier when he spoke, that the absence of evidence doesn't mean that there is no evidence. It just means that this is a challenge in the follow-up to this paper. Others are invited to join in this broadening of the research program. Also, by setting a deadline of 5 years means that something that might be 6 or 7 years would have been dropped out. So these are all caveats in the interpretation of this paper, and we're not arguing against any effective intervention that takes longer. Indeed, maybe sustainable interventions require that we work for longer on a broader range than these 25. As evidenced by having a colleague, we often highlight the importance of a champion who happens to be in place at the right time, but we also need to recognize a person like Leila, who has been in this field, not just at national, but also at regional and international level, and to salute the long-term persistence and resilience in these struggles.
Indeed, this aligns, I think, with WHO's both as we talk about race to the finish and this need to achieve progress in the next 5 years, but simultaneously looking ahead to 2050 and that vision 2050. What are the long changes we need to keep working on over the years? So also, Leila, I hear your call for continued support on translating evidence to policy. This is a very important point. And so I thank you again for sharing your insight and for joining us today. And next, I would like to introduce Dr. Benedetta Armosiada, who's the coordinator for the Joint Action on Cardiovascular Disease and Diabetes, JACARDI. Thank you for joining us. You are, as I mentioned, a coordinator of JACARDI. How do you see the findings of this paper contributing to JACARDI's efforts to support countries to reduce the burden of CVD, cardiovascular diseases and diabetes? Over to you.
Thank you. Thank you very much, Alison, and thank you for inviting me. And again, congratulations on this important milestone. This is a real privilege to join you today for this inspiring discussion on quick buys. Advancing cost-effective policy is a global health priority. And as you have mentioned, the paper makes a critical contribution by introducing structured timeframe, an essential component for strategic planning, implementation, and impact assessment. As we reflect on how these insights can inform this and strengthen our collective effort, I would like to highlight 3 key points that are particularly relevant for JACARDI and broader public health initiatives. First, JACARDI, like other European initiatives, operates within defined timeframes, and the structured approach outlined in the paper reinforces our ability to align best buys and quick buys with policy cycles, ensuring that interventions really intervention are effectively implemented, monitored, and adapted based on improved evidence. This systematic approach enhances accountability and fosters long-term sustainability. The second point is that, and also as has been reported previously, the study underscored the need for more natural experiments to assess the real-world impact of interventions. This is precisely where joint action like JACARDI can play a crucial role. By generating robust implementation research, joint action provides essential evidence on feasibility, scalability, and sustainability of interventions. JACARDI serves as a bridge between research and policy, facilitating the translation of evidence into concrete, actionable strategy at national and regional levels. And the third point that, again, has been previously mentioned by other panelists and colleagues is that the paper really highlights the importance of stakeholder collaboration and multi-sector approach. And again, joint action can play a crucial role in this multi-stakeholder collaboration. by fostering cooperation among member states and key EU stakeholders and diverse sectors, can create a platform for knowledge exchange, capacity building, and coordinated policy responses. This collaborative approach extends beyond national boundaries, contributing to a more integrated and effective NCDs prevention and control framework at European level. As we move forward, it is essential that insight from this paper, particularly the structured timeframes, the need for stronger evidence, and the power of multi-stakeholder collaboration translate into concrete policy action. And I look forward to continued collaboration to drive forward this initiative and strengthen the evidence to policy pathway for NCDs prevention and control. Thank you again for the opportunity to contribute to this discussion on behalf of all the consortium.
Thank you so much, Benedetta. What I'm hearing again is the importance of accountability, the translation of evidence to policy and implementation, and stakeholder engagement. But I also want to come back, you mentioned the importance of the natural experiments. And as David said earlier, this is really the end of the beginning. So I don't know if David or Godin want to say a bit about natural experiments and that work that's ongoing.
I mean, a challenge for researchers in public health is we're dealing with policies that affect entire populations. So that means the typical tools that we have in medicine of randomized controlled trials in the artificial setting of the lab just don't work. The lab is our real world, our real lived experiences where we experience risks of chronic diseases. And so that challenge means often the WHO has a tool called GRADE for grading the quality of evidence. Unfortunately, a lot of the population health evaluations are ranked low and weak in evidence. And the tools that we're now using are kind of epidemiology 2.0. They enable us to simulate the benefits of a randomized controlled trial, but with entire populations. And so Gowden and the team has been at the forefront of advancing this forward, but this helps us to identify evidence that's as rigorous as if it were a randomized controlled trial. So I think our fresh look at the data here on the best buys to identify a set of quick buys reveals also a challenge for us as researchers to bring time back into the equation. It's not just enough anymore to show that these are effective and cost effective. We also as researchers need to establish when.
Thank you, David. Okay, good. So thank you again so much for joining us, Benedetta. And now I would like to bring in Dr. Hanna Talonen, who's representing the joint action on preventing non-communicable diseases. So this is JA Prevent NCD. Dr. Talonen, the joint action is supporting strategies and policies that aim to reduce the burden of cancer and NCDs and help countries achieve their targets. Something we have not talked about, but we're hearing others bring up today is, and we didn't evaluate in the paper, though, is the role of surveillance and monitoring. So why is this so important to achieving our targets? Over to you.
Thank you. And first of all, thank you for the invitation to provide the feedback from the JR Prevent NCD. And congratulations from the excellent paper that will be really helpful for us in the Prevent NCD as well when we are working on our policy evaluations for the tobacco, alcohol, diet, and physical activity, especially on the cancer side. But as said, the evaluation, monitoring and evaluation was not mentioned as a best buys or quick buys here, but that's the basis. We actually need the data on the risk factor status within the population when we are looking for, do we need to do the interventions? And that's why we would need the health surveys in the countries to be able to identify what are the population groups which might have the problems, for example, with the smoking, alcohol use, unhealthy diet, physical inactivity. And when we have that information from our survey data, then we can target our interventions better for those population groups which are in the most of the need for the interventions. But at the same time, we need to also have a disease surveillance, information how the disease prevalence, mortality, and morbidity is developing within the country. Because if we don't have that information, we don't know are our interventions on the risk factors actually impacting the disease burden. So there need to be well-established risk factor surveillance systems as well as disease surveillance systems within the countries to make the best out of the interventions, to see their impact on the population level, and to see are they actually cost effective. So that's the key for the evidence-based activities we are planning for the countries when we are doing these interventions. And within the Prevent NCD, we are actually working also on the monitoring aspects to see how the countries are doing the monitoring currently and how we could support them to improve their monitoring activities, both for the risk factors, but the diseases as well.
Thank you so much, Henna. And absolutely, the data, the surveillance, the monitoring is really the foundation of all of this research. I don't know if you want to make another comment on that. I know you addressed the importance of data, but...
Tremendously important. If we don't have the data, it's like driving a car without a dashboard. We can't see where we're going. I mean, if you invest money in a stock, you want to know what return you get on your investment. The same thing with health. Our leaders are investing in the health of their people. We need to take that step to see what gains we're getting. And if we're not getting the gains that we expect, so that we can adjust and chart the right course along the way. Thank you so much for bringing that up.
Thank you, David.
And from my side, appreciation to both joint actions. Benedetta, Hanna, you represent two consortia where WHO is an observer, but we feel so much part of them that we're almost like members on a date. And in fact, it was we had a soft launch of the Quick Buys paper at a recent meeting of the consortia. And at those meetings, we tend to hear that, of course, it's not just the effectiveness, it's not just the cost effectiveness, it's not just the rapidity, but also elements of what is the overall, how do you model the overall impact of these interventions? Do they improve equity or worsen it? The indication is that there would be an improvement in equity, but these are questions that would be raised for further research. And absolutely, we need the data such as can be collected by consortia, such as the ones you represent. So thank you for being with us.
Thank you so much, Henna, for joining. And next, I would like to welcome Miranda Wang, who's a policy and advocacy specialist with NCD Alliance. And Miranda, we've heard a lot about civil society engagement and multi-stakeholder engagement today. So NCD Alliance plays a crucial role in driving global advocacy and sustaining political momentum, promoting accountability on NCDs. So as the policy and advocacy specialist, how do you see the Quick Buys contributing to that momentum? And how might civil society leverage them to accelerate action? Over to you.
I thank you for the opportunity to join today, and a huge congratulations on the launch of this timely report. I think from an advocacy perspective, the Quick Buys paper is incredibly useful because it adds something we often lack in policy conversations, and that's a clear sense of time. As we move forward to 2030, it's not always clear where countries need to start, especially with all the competing priorities. And I think this paper brings a sharper focus to interventions that can deliver results quickly, which is crucial as countries chart their paths to 2030. And that's a really powerful framing for both decision makers and advocates alike. I think many mentioned, of course, we know that the Best Buys and Appendix 3 are a great resource for identifying the cost-effective NCD interventions. And I like this paper because it goes a step further and it can help countries prioritize not just what works, but what can work quickly, which is a vital consideration for closing the implementation gap in the short term. And the launch, as you mentioned, is really great timing. As we all prepare for the UN high-level meeting in September, this gives a very practical menu of options to include in the global and national commitments and a pathway towards actually achieving the 2030 targets. I think from the civil society perspective, it's an incredibly valuable advocacy tool. The quick buys adds the useful time component when advocates push for these proven policies that we've all been pushing for a very long time. It allows us to say not only that, this works, but this can deliver results within 5 years, which is a very compelling message for our public health and budget advocacy efforts. I think this also aligns well with NCD Alliance's Civil Society open letter. The call to lead on NCDs, 3 actions all governments must take, which is signed by almost 400 organizations across 90 countries, and where we're urging governments to act on 3 priorities: mobilizing investment, accelerating implementation, and delivering accountability. And this quick buys report backs that call, especially by highlighting interventions that can unlock investment and speed up implementation. Finally, as we look beyond 2030 and towards 2050, we know that these interventions are not the full suite of solutions, but I think they can be a really great stepping stone to spur action, and they offer governments a chance to act now on NCDs and see measurable impact within political cycles, something that I think leaders would all like to hear. So thank you again. I look forward to drawing on the quick buys in our advocacy messaging and seeing how it can help accelerate progress in NCD prevention, financing, and care.
Thank you so much, Miranda. It's nice to hear how a lot of the comments are really aligning around these issues of implementation and accountability, also investment. So thank you so much for joining. And I think really these can help to advance advocates' efforts as well. So now I would like to invite Dr. Heather Brown from the Lancet Regional Health Europe, who is with us today. Dr. Brown, thank you for joining. And why is this publication important and timely for public health in Europe? What can you tell us about the journal's plans following this paper? Thank you.
Thank you. Many thanks for asking me to join you today. I'm one of the editors at the Lancet Regional Health Europe, and we're really pleased to be able to publish this paper. We think it's hugely important because non-communicable diseases are the leading cause of premature mortality in the region. And these diseases can have profound consequences for people and their families, as well as posing huge challenges to healthcare systems. This paper provides a way in which policymakers can do more to prevent and control these diseases in Europe and elsewhere. So it provides a way in which they can improve people's lives and save lives. And we think the paper is incredibly timely because of the focus on interventions that can have measurable effects within 5 years. 5 years is the time we have left until the SDG target deadline in 2030. And as we've heard, it's also the length of time of a typical political term in Europe. And many countries have recently had elections or will have elections later this year. As the paper says, policymakers often, for various reasons, prioritise changes that can bring quick results. And now here are 25 changes that can bring those quick results, many of them in less than 5 years. The paper shows that there is still time for politicians to make a difference in reducing the burden of NCDs, and that actually, with some of the benefits potentially being much quicker than 5 years, in some ways now is an ideal time to take action. And to follow up after publication, we're hoping to highlight the paper in an editorial and a podcast. We don't know exactly when yet, the dates are to be confirmed, but probably in May.
Thank you so much. And we really appreciate your publication of the paper and joining us today. And Gordon and David, if you had any comments on our last 2 speakers.
I want to congratulate the NCD Alliance. Sorry, apologies. I want to congratulate the NCD Alliance on the major movement that they have brought together in preparation for the UN high-level meeting. And indeed, I would encourage many people on this, everyone in this audience, to go and look at their website for a wide range of advocacy material that they have been compiling over the last year, actually 2 years. So in a way, we have both been working on the 100-week challenge, preparing for the UN high-level meeting in different ways. And to Heather, simply thank you for believing in the project, because you showed an interest in it when it was just an idea, not a product.
Thank you, Godin. Well, that brings us to an end of our speakers. However, I'm going to ask each of our co-authors to make some closing remarks. And Martin, I'd like to come to you first. Over to you.
So I think what the very important point I take out of this is one that Gaudin and David made, the importance of natural experiments. And it picks up one of the points that was in the chat where someone was raising the issue of the quality of evidence. I think sometimes when we're looking at public health interventions, we have engaged in what one of my colleagues called methodolatry. In other words, taking certain methods and privileging them over all others, in particular the randomized controlled trial, which of course is very appropriate, the best thing to do in many circumstances. But when we're looking at population level interventions, we really can learn a huge amount from when governments change policies if we track the data. And I think we need to be encouraging governments to collect the appropriate data. And then, as I know that Gaudin has been thinking about for some time, WHO supporting the governments and academia to apply the increasingly sophisticated methods, synthetic controls, interrupted time series analysis, a whole series of others, which allow us to attribute cause and effect with those policies that are changing. Essentially, if governments are introducing any large-scale policy, they should be evaluating it, and natural experiments are a good way of doing it.
Thank you so much for that. David, some closing remarks from you.
I mean, as I mentioned, this paper was years in the making, and it's in a way emotional for me to see it come out. I remember when I did my public health training, professors were saying, one study can't make a difference. I believe this paper can. I believe the future of public health and where we are going is, we already know public health is one of the most powerful investments we can make. And now we're able to say, for the first time, when can we really start to see that return to help guide smart decisions? This paper is a roadmap to action. Mm-hmm. And the payoff, again, for civil society, we heard a lot from today, is that this can hold our politicians accountable. We know these are cost effective. We know they work across different countries, across different settings. There are no more excuses. Mm-hmm. No excuses not to implement these right now.
Well said. Thank you, David. And to you, Godin.
And it's difficult to follow both Martin and David. We've acknowledged 5 of the authors, but I also want to acknowledge the fact that it's a broader author group, and I know that there's a very active chat going on. Given the limitations of time, we will have other opportunities to bring an open discussion on what is happening, but I can see that some of the questions can already be answered by actually reading the paper. So I encourage people to, as you hop off this presentation and launch, to go through the paper, to critique it, but also to work with us in taking the next steps, doing the natural experiments, doing the modeling studies that need to be done to attribute and assign impact. But most importantly, even before any of that research is done, we have 26 weeks to the UN high-level meeting. There are a number of papers that have come out from across the regions on statements that are being made by different groups on what should go into the political declaration for the UN high-level meeting. May this paper be our building block on offer to those debates. Please use it to activate your advocates in the country, ensure that we have a strong political declaration coming out to drive the next 5 years as we go forward to 2030.
Thank you, Godin. And I must say, it's truly been an honor to be a part of this project over the last 2 years, and it is also really amazing to see it come out into fruition today. You've heard this call to action. You can find a link to the full paper in the chat and on our website. So please, as Godin said, please read the paper, and we invite you to give us feedback. And again, you will hear more from us about this. We will be following up on this. So, and as Godin said, I really want to thank all of the co-authors, and not just the co-authors. Here's the paper. I want to thank the co-authors, but I also want to thank all the people behind the scenes that made this possible today. Those in the studio, our translation, and the communications team who really make this a success. And so with that, I'm going to bring this to a close, but thank you so much for joining us today, and we look forward to seeing you again. Thank you. And that's a wrap.